Okay, so have you ever been lying awake at like 3 a.m. with an ache that feels just fundamentally illogical? It's not a muscle pull, right? It's not a bruise. It just feels like your body's hired this tiny disgruntled construction crew to work on some random patch of tissue.
Yeah, it's that chronic, mysterious pain that just frustrates everyone because, well, we're trained to think pain equals some kind of direct trauma. But what if that deep, confusing discomfort was actually like a cryptic clue, a signal pointing not towards some scary diagnosis, but something weirdly specific, like a temporary backup in your internal plumbing?
Okay, let's unpack this then. We're doing a deep dive into inflammation,
Mm.
but we're skipping the usual lecture where the answer is always just eat more kale and meditate.
Right.
We're looking for the secret causes, the mechanical or microscopic triggers that just get completely overlooked. We're kind of on a mission here to figure out why the immune system sometimes acts less like a protective guard and, well, more like an overcaffeinated drama queen.
Yeah. And we really must establish the stakes right away. Inflammation isn't just about that localized pain. If it drags on, if it becomes chronic, it changes the whole operating environment of the body.
Hmm.
What's fascinating here is the connection. Inflammation often means a lack of oxygen hypoxia, we call it, in the surrounding tissue. And both inflammation and hypoxia, they create the kind of toxic synergy that causes serious issues like cancer to grow much, much more aggressively. So chronic inflammation is basically the welcome mat inviting deeper trouble in.
Okay, that makes the stakes extremely clear. So let's start with one of the most bizarre cases of localized inflammation, the right side mystery. This is where it gets really interesting. One practitioner's review found that, get this, 100% of patients reporting fibromyalgia, that widespread deep inflammatory pain,
Mm-hmm.
had the pain concentrated only on the right side of the body. Why? Why is your right side holding all the grudges?
It's almost comical, the answer, because it's so specific. The issue often traces back to the drainage system, right underneath your right rib cage where the liver and gallbladder live.
Yeah.
The bile your liver produces, which you need for digestion, right? It's supposed to flow easily down through these tiny ducts.
Mm-hmm.
But if it thickens up, people call it bile sludge, it creates this mechanical resistance, a backup.
So we are literally talking about internal plumbing problems
Yeah.
causing widespread pain.
Right.
Okay, I need a clear analogy here to really grasp this.
Okay, think of bile like a really potent kind of corrosive detergent. If your kitchen sink backs up because the grease got too thick, that harsh detergent just sits there, right? And it irritates everything in the pipes.
Right, okay.
Well, when bile sludge backs up into the sensitive liver, it causes irritation that the body reads as pain. And because of the nerve pathways, specifically something called the phrenic nerve, that pain doesn't just stay put in the liver, it radiates directly up into the right shoulder and neck.
That's amazing. So it's referred pain, a problem down in the abdomen registering way up in the shoulder. But that 100% statistic, that sounds incredibly powerful. Was that from just one specific practitioner's research or like a broader consensus study? Are there, counter arguments showing left-sided issues?
Yeah, good question. That specific 100% figure, it came from one specialized clinical research center really focusing on this liver and biliary connection. Now, while other causes definitely exist for widespread pain, this finding on localized right-sided fibromyalgia pain, it's incredibly consistent within those circles. It really suggests that for many people, the fix is actually mechanical.
And the fix, the unexpected fix here, is almost unbelievable. You're saying just massaging like deeply underneath the right rib cage,
Yeah.
holding the pressure for about a minute and watching the pain drop dramatically. I mean, for someone struggling with chronic pain, that simple massage, it just sounds almost too simplistic. How durable is that immediate relief?
Well, it speaks to immediate mechanical relief, right? You've temporarily opened the valve, so to speak. If the pain vanishes immediately, well, you know the mechanical backup was likely the cause. For a durable long-term fix, the goal is to address the sludge itself. So that means supporting bile flow, often by taking specialized bile salts. A common one is TUDCA, torsodioxycholic acid.
TUDCA, okay.
It's specifically designed to thin the bile and keep that drainage system flowing nice and smoothly.
Incredible. Okay, so we move from that localized plumbing pain to systemic widespread pain. If the pain is truly everywhere,
Yeah.
now we're moving out of the bile department, right? And into the realm of like secret biological agents.
Exactly. If the fibromyalgia pain is generalized all across the body, the source is usually systemic, and frequently it traces back to a latent virus coming out of remission. We're almost always talking about the herpes family of viruses, Epstein-Barr, shingles, cytomegalovirus. They love to hide out in nerve tissue, just waiting for their moment.
And what causes these otherwise dormant viruses to suddenly pop back up and declare war on your entire body?
Chronic, relentless stress. That's the big trigger. When we stress, our body goes into fight or flight, right? It floods the system with cortisol. Cortisol is supposed to be helpful, like an emergency brake, but it also strategically suppresses the immune system so you can focus on, running from the tiger.
Uh-huh.
So if the immune system is distracted dealing with the stress crisis, those latent viruses, they get the perfect opportunity to reactivate and cause that widespread systemic inflammation.
But wait, okay, here's the dramatic irony that completely flips the script.
Yeah.
Cortisol is supposed to be the body's ultimate anti-inflammatory hormone.
Yeah.
So how does stressing out make inflammation worse?
This is the twist most people miss. It's crucial. If you have constantly high levels of cortisol over a long time, like if your life feels like one unending emergency, you develop what we call cortisol resistance.
Okay.
Just your cell receptors basically stop listening. They've been flooded for too long. And suddenly that powerful anti-inflammatory fire extinguisher, the one that was supposed to put out the inflammation, it malfunctions. It starts spraying gasoline instead. The very hormone designed to protect you ends up causing more systemic inflammation.
Wow. And chronic stress doesn't just create a viral opening, right? It also messes with gut permeability, leading to leaky gut, which seems like the perfect setup for our next segment. If anything causes more chronic stress to the body than a backed-up bile duct, it's probably what we shove down our throats every day. Let's talk dietary double agents.
Yeah, transitioning to diet is essential because it's a source of daily chronic low-grade irritation. Inflammation often starts right there in the gut. If you're eating something that is chronically irritating your colon like certain modern grains, especially wheat for many people, you get constant inflammation. And that feeds directly into that critical gut-brain axis.
And what blows my mind is how certain grains are still promoted as like the pinnacle of wellness, yet for so many, they're literally irritating the digestive tract constantly. But okay, grains are kind of the obvious villain. What are the sneaky ones?
Right. We need to look beyond just plain white sugar. The bigger villains are often the, let's call them junky industrial synthetic sugars, and critically, the hidden starches. Things like modified cornstarch, modified food starch, and especially maltodextrin. These are cheap fillers, designed to make food taste good and feel thick. Shockingly, the average person consumes over 50 pounds of this hidden starch every single year.
50 pounds. That's literally the weight of a small dog, a fluffy one, where the hidden starch you don't even realize you're eating. That must be spiking blood sugar constantly.
Oh, astronomically. It keeps the entire body just simmering in this persistent state of high inflammation. But, okay, if hidden starch is the sneaky villain, the title of worst of the worst, that has to go unequivocally to industrial seed oils.
Can you expand on the mechanism there? Why are seed oils, like soybean, corn, canola oil, why are they so much worse than other fats?
Well, they're structural saboteurs. These fats, they're highly fragile, often oxidized before they even make it into your kitchen. When you eat them, they don't just pass through to be burned for energy. No. Instead, they get literally locked into your cell membranes, replacing the healthy fats that should be there. This fundamentally messes up the function of pretty much every single cell in your body.
And this leads to that shocking statistic I saw about how persistent they are. It's kind of scary.
They are incredibly stubborn. Yeah, if you stopped eating industrial seed oils today, right now, it could take a year and a half, like 18 months, to completely clear them out of your cell membranes and restore proper cellular function.
18 months.
Yeah. Meanwhile, the average consumption is somewhere between 5 and 8 gallons annually. We are literally building our bodies out of faulty construction material.
And this overconsumption, the starch, the unstable fats, it leads directly to the body's big storage mistake, insulin resistance.
Precisely. The body tries, to manage this constant flood of energy, but the cells eventually just resist the insulin signals. They get tired of hearing it. So instead of the energy being neatly packed away inside a fat cell, the fat starts storing outside the cell, specifically around your organs. That is visceral fat, and that fat is not just sitting there. It's metabolically active and massively inflammatory, constantly pumping out inflammatory signals, cytokines, into your bloodstream.
Okay, so we've covered our internal biochemistry, our diet. Now let's talk about the world around us. Segment 4, invisible shields and unexpected energy fields.
Yeah, we have to first just touch on the sedentary sickness. Old injuries, chronic joint pain, arthritis, they're almost always compounded by just being sedentary. The biggest enemy to recovery, ironically, is not moving. You need to constantly work on stretching, but specifically focusing on the fascia.
Fascia. Okay, that's one of those terms that gets thrown around a lot. For the layperson, what exactly is fascia, and why does stretching it specifically matter for inflammation?
Okay, think of fascia like cling wrap. It's the connective tissue that wraps around every single muscle, every organ, every bundle of nerves in your whole body. If you've ever pulled apart a piece of raw chicken breast and seen that thin, white, kind of shiny membrane, that's fascia.
Okay.
Got it. When it tightens up, maybe from an old injury or just lack of movement, it physically restricts blood flow and lymph drainage. And if fluid can't move, well, inflammation builds up. You have to actively work that tissue constantly to keep things flowing.
That makes perfect sense. Now let's wade into the truly weird stuff. The electromagnetic drama. You shared a really unsettling anecdote about EMFs. This sounds almost like science fiction, but the effects seem absolutely real.
It really is, and it shows how much we prioritize what we can see over these invisible hazards. If you use a device constantly, or you're just constantly exposed to these fields, you can get inflammation, particularly in the brain. The most striking personal story involved scanning a house for EMF radiation. I was having palpitations at the time, and insomnia, couldn't figure it out. When the technician scanned near my headboard, the meter went completely off the chart, just wild readings.
Wow. What caused that spike? What was it?
It turned out there were crossed electrical wires inside the wall, creating this strong magnetic field that extended 8 feet out from the wall. I was literally sleeping in a magnetic bath every single night.
A magnetic bath?
Yeah.
Causing palpitations and stopping sleep. That really drives home how much we overlook these invisible stressors in our environment.
Exactly. And as soon as we fixed that wiring, fixed the magnetic field, the palpitations completely vanished, and I started sleeping normally again, like instantly. It just highlights the massive inflammatory impact of these invisible environmental hazards that we just never connect to our chronic pain.
And speaking of hazards, we could briefly acknowledge the drug domino effect. It's a sad reality, isn't it? That many people struggling with chronic issues end up on like 15 or 20 different medications.
Yeah, and you can pretty much guarantee that some of those medications are causing inflammation as a known side effect, which then requires another medication to treat that side effect. The body just ends up in this state of massive pharmacological confusion. It really underscores the critical need to find a medical professional who can help safely explore, weaning off certain unnecessary medications to reduce the body's overall inflammatory load.
Right. Okay, let's pivot now to the Bizarro toolkit. Some really counterintuitive remedies that surprise almost everyone. First up, iron's treachery. We are constantly told we need more iron, right?
Yeah.
But the opposite can be a major inflammatory problem.
That's absolutely right. Having too much iron in the body is highly inflammatory. Iron, while it's essential, causes significant oxidative stress when it accumulates, and that leads to chronic inflammation, can damage the liver, even potentially lead to cirrhosis. Many men, and especially postmenopausal women, they tend to accumulate iron over time.
So what's the simple diagnostic test? How do you figure out if you have too much iron without complex labs?
Well, what's fascinating here is this simple anecdote. If you feel remarkably better, like suddenly energetic, clear-headed, after donating blood, which physically removes excess iron, that's your body telling you, loud and clear, you probably have an iron issue.
Oh.
It's an easy, pretty low-risk way to test the theory. Unless you have a specific diagnosis of anemia, you really should probably never take iron in a supplement because it can easily compound that inflammatory load.
Okay, good tip. And then there's vitamin D, which sounds less like a vitamin and more like an immune system thermostat, just regulating everything.
That's the perfect description for it. Vitamin D is arguably the most important vitamin for your immune system because it is the ultimate regulator. It has this unique ability to either boost an underactive immune system, maybe one that's failing to fight off viruses, or crucially bring down an overactive one, which is absolutely key in managing autoimmune issues.
Okay, but if you're tackling a serious autoimmune condition, you can't just pop D3 alone and expect miracles, right?
Yeah.
What are the required cofactors you mentioned?
Absolutely not. You need the synergistic supplements. Otherwise, the body just can't utilize the D properly. We're talking magnesium, zinc, and vitamin K2. They all work together. And for gut-based autoimmune issues, a strong approach often involves using a specialized probiotic, Lactobacillus reuteri, which has some really specific immune-modulating properties.
And then there's the really drastic dietary approach mentioned, the carnivore diet. That sounds like a pretty temporary extreme measure. How should people approach that without, throwing their whole metabolism out of whack?
Right. It's absolutely crucial to understand it as an elimination protocol, not a forever lifestyle choice for most people. For severe, non-responsive autoimmune issues, going full carnivore for maybe a few months can potentially eliminate 99% of all potential food irritants. It's designed to quiet the system down so much that the immune system finally gets a break. But the key, the absolute key, is the slow reintroduction afterwards. Things like ferments, sauerkraut first to see what the body tolerates, and to carefully rebuild the microbial environment.
Okay, elimination, not forever. Got it. And finally, let's wrap up the Bizarro toolkit with the trick they don't teach you in school, the opposite technique. What's that about?
This is one of the wildest neurological remedies, honestly. Anywhere you feel pain or inflammation in your body, if you press firmly on the exact opposite side, the mirror image spot, it can often completely get rid of the pain, like immediately.
Seriously?
Yeah, it's some kind of cross-wiring phenomenon in the nervous system. It's a simple, immediate trick to try that can sometimes yield unbelievable results. Worth a shot, right?
Definitely worth a shot. Okay, so what does this all mean? We started this deep dive with, vague right-sided aches and pains. And we ended up examining clogged plumbing, hidden starches in our breakfast cereal, magnetic bed frames, and the surprisingly dangerous element of having too much iron. Inflammation is clearly not a one-size-fits-all problem. It's really a symptom, isn't it, of things we overlook every single day.
It really raises an important question, I think. If inflammation is often a result of this kind of systemic exhaustion and chronic low-grade exposure, rather than just a direct injury, maybe the deepest dive we actually need to take is into the quality of our recovery and our environment, not just the volume of our effort or what pill to take.
Yeah, so if your body's constantly sending out these emergency flares, maybe the first step isn't always medication. Maybe it's checking what's hiding behind your headboard or, why your bile duct might be throwing a temper tantrum. Think about that.